So here's a physical examination of the hip and the pelvis. The first thing that we do is when we examine the patients is that we want to assess for range of motion. Range of motion is really important, especially when examining the young adult patient with hip pain. Our patient today is complaining of right hip pain, so we'll go ahead and examine his right hip. The motions that we want to examine is flexion, and he's probably about 100 degrees of flexion. External rotation with the hip flex, he's probably about 20 degrees, and internal rotation, he's probably about 10 degrees. And we always want to compare that to the opposite side. We'll also measure abduction and adduction. And again, we'll compare his affected side to the non-affected side. So his left side, he gets again to about 100, rotates to about 20. Externally, internally, he's probably about neutral. And again, we'll check for abduction and adduction. And when we're examining just their passive motion, if there is some subtle asymmetry, usually that could be significant in terms of suggesting that there might be mechanical impingement. In terms of provocative maneuvers, in terms of further examination, just in terms of palpation, we want to palpate the bony prominences. So we'll feel over the anterior superior iliac spine. We'll feel over the hip flexor area or the iliopsoas. We can also feel over the adductor origin, which is right where it meets the pubis, and see if any of those elicit pain, sometimes the pubic tubercle as well. When examining for impingement, we'll examine with the hip flexed that we'll have him hyperflex. This is what we call subspine impingement. Flexion, adduction, interrotation is our classic impingement test. And typically we want to get a sense as to how extensive the pain might be. So we'll go from, let's say, 11 o'clock, 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock. And we want to try to correlate this where their pain pattern might be or where their mechanical damage appearance would be as well. The other thing that we want to test for is what we call the favor position, which is helpful to elicit any pain in the SI joint. We also like to look at this for psoas tightness. Some people like to measure the distance from the distal femur to the bed of the exam table, the top of the exam table, to see if there's any stiffness in the hip. We'll also test for apprehension, where we'll see if there's any pain with either log roll or with excessive external rotation. In this case, he's got a nice recoil, but in some cases, if you try to forcibly externally rotate the foot, they may stay in a fixed externally rotated position. Then we'll have him scoot down to the edge of the bed and do what's called a posterior. Have you go down a little bit further. A posterior impingement test. Yep, just kind of let the hip extend, and then we'll forcibly externally rotate the hip to see if he has a pain with posterior impingement. If there's either a posterior cam or if there is excessive posterior rim, we'll have him come back up. And the last impingement test is with hyperabduction, so we'll just go ahead and bring his hip out into abduction, and this might elicit pain with the lateral aspect of the acetabulum. In terms of looking for athletic pubalgia, again, or core muscle injuries, we'll palpate over the adductor insertion. We'll have him resist our adduction. We can also palpate over the pubic tubercle. We'll have him do a resist sit-up. Yep, good, resist me. And if any of those maneuvers create pain, that would be positive for core muscle injury. We'll also do a strength assessment, so we'll have them bring both knees up. We'll have them abduct against manual testing, abduction, adduction, and then straighten legs out. This one too, and then hip flexion, and that will conclude our supine examination. Next, we'll have him lie in a lateral position. So again, we'll kind of palpate our bony prominences. So iliac crest, greater trochanter, and when we're palpating greater trochanter, we want to palpate the gluteus minimus facet, which is a little bit more anteromedial, the lateral facet of the gluteus medius, and the supraposterior facet. We'll have them raise his leg up, both with the knee extended and the knee flexed. Go ahead and bend the knee. And then again, resistance against abduction. We will see if he has pain with direct palpation. We'll also have him do a bicycle maneuver, have like you're pedaling a bike, and see if there's any snapping in the IT band. Good. And then we'll also kind of palpate over the ASIS, palpate over the proximal hamstring or the ischium as well. The other maneuver that we will want to do is for ischiofemoral impingement. We'll go ahead and see if he has normal hip extension. And in some cases, some patients might not have normal hip extension with the leg in neutral. But with abduction, they might have much more extension. So this is for ischiofemoral impingement. Let me have you bring both the knees up in flexion, good, all the way up to your chest. And then we'll also check for IT band tightness. This is also known as the over test. Front examination is helpful for a couple reasons. One is that you can get a sense as to what their rotational profile looks like. Again, this is external rotation, internal rotation, and so this will help to correlate what you think their rotational profile might be. The other way that this could be helpful is that we can also palpate over bony prominences in the posterior aspect of the hip and the pelvis. So you can feel the greater trochanter over here, the ischium, proximal hamstring. To elicit pain over the proximal hamstring, we'll palpate around the ischium. We'll have him bend his knee up. Great. We'll have him resist knee flexion and see if that feels like his hamstring is normal. We can also have him elevate the whole leg off the bed and see if his glute max appears to be in good condition, which it is. We'll also feel over the lumbar spine, coccyx over here, as well as the PSIS or the SI joint on either side to see if that might elicit pain. We'll feel over the posterior iliac crest as well, and just get a sense as to if there's any other pain in the back of the hip and pelvis.